A crescentic or a banana-shaped image on a CT scan of head of a patient of head injury is most commonly seen in epidural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, or cerebral hemorrhage. The answer is subdural hemorrhage. This is indicative of subdural hemorrhage. However, in epidural hemorrhage, there will be a lentiform, a lens-shaped or a lemon-shaped, you can say, image seen in CT scan of head after head injury. Now, it's equally important to know that why do we get such images on CT scan in these intracranial hemorrhages? This crescentic shape of subdural hemorrhage is seen because the blood which is deposited between the dura mater and the lying subarachnoid matter. So that blood or the hematoma that spreads and follows the shape of the brain and the contours of the subdural space, which is convex, and the cranial vault is concave. So convex on one side and concave on the other side, we get is a crescentic image, right? Now, it is equally important to understand that why there is a lentiform, a lens-shaped or a biconvex or a lemon-shaped shadow is seen in an epidural or extradural hematoma. This is also due to the way the blood accumulates within the space between the inner table of the cranial vault and the outer layer of the dura that we call as endocranium, the periosteum of the bone covering from inside. It's the outer layer of the dura. We call it as endocranium, right? So the blood is between the cranial vault and the outer layer of the dura. And remember that there is a pericranium also. Cranial vault is covered by periosteum both from outside and inside. The outside layer of the periosteum we call as pericranium. Underneath to that, if the blood collects, that is called cephalohematoma, that I taught you while I was teaching the clinical anatomy of the scalp. And remember that cephalohematoma also had a limited spread because of the sutural lines. The pericranium is attached with the sutural ligaments. So the shape of the blood collected below the pericranium and the outer table has a limited spread. It eventually takes the shape of the bone concerned on which there is a hematoma. So that was the characteristic of cephalohematoma, that the blood didn't cross the midline, the sagittal plane, the sagittal suture. Mostly it's overlying to the parietal bones or the frontal bones, but it didn't cross the suture lines. Same applies here also. Now, epidural or extradural hematoma is the blood deposited between the inner table and the endocranium. That's the outer layer of the dura mater. And same dura mater or the endocranium is also attached with the intersutural ligaments. So here also the epidural hematoma has a limited spread. It spreads, and after being limited by the sutural ligaments, it starts bulging inwards towards the brain parenchyma, right? And because the cranial vault is convex outside and this epidural hematoma starts bulging inside, so that takes a lentiform shape, a biconvex shape. So remember now, the epidural hematoma and cephalohematoma are somewhat similar. Outside the outer table of the cranial vault, there is cephalohematoma, which is associated with the scalp injuries, and a hematoma just below the inner table of the cranial vault is epidural hematoma, which is a part of intracranial hemorrhage.